So there's type 1 diabetes and type 2 diabetes. Type 1 diabetes is a condition when your body does not produce enough insulin, so your body is unable to utilize the sugars in your blood. And then type 2 diabetes is a condition when your body does make insulin, but the body is not responding to insulin properly, so it's still unable to utilize the sugars in your blood. Diabetics have a variety of presentations, but the main part is their high blood sugars. Also, they will present with increased thirst, increased urination, increased appetite. To ensure a good future outlook for diabetics, we must monitor how well they are responding to their meds, as many of them have their own unique side effects. If their treatment is with sulfonylureas, they are at risk for weight gain and inappropriately low blood sugars. They are therefore at risk of getting dizzy, fatigued, lightheaded. If their treatment is with GLP-1 agonists, they can actually lose weight. If their treatment is with SGLT2 inhibitors, they will be peeing out a lot of their sugars, so they'll be at risk for urinary tract infections. Got to keep an eye out for that. Future outlook of diabetics is widely variable. I mean, they're at risk for liver problems, eye problems, urinary problems, kidney problems. They can have numbness and tingling in their feet. They can even end up growing stuff on their feet and have gangrene. First-line treatment for type 1 diabetics is insulin, given that their bodies are not producing insulin. But for type 2 diabetics who are producing insulin and the insulin is just not working, their first-line treatment is metformin. However, if they have kidney problems, metformin is not a good treatment, and they must try other options such as sulfonylureas, GLP-1 agonists, SGLT2 inhibitors. So insulin is what causes your body to utilize sugars so that you have enough energy. So diabetics have a problem either producing insulin or they can't produce insulin and their body's just not responding to it. So either way, type 1 and type 2 diabetics have high blood sugars. And high blood sugars can function as a diuretic, which is why diabetics end up urinating a lot. Also, high blood sugars that aren't getting utilized by the body means that the body will be starved of sugars and energy, which is why diabetics are often hungry all the time. It's so sad to see how diabetics have so many problems to overcome, constantly having to pee, always thirsty and hungry, and then they have to constantly count their carbs and be cautious about their eating and exercising. I feel so sorry for them. I hope I can truly help them not feel so awful. Man, the constant peeing, thirst, hunger, feet tingling, I would totally lose my mind if I had such problems. Oh my gosh, I would hate to have to count carbs. That just sounds so tedious. It's up to me to end the agony that these diabetic patients are going through, because seeing them go through such things just makes me feel awful.